Hi, today we're going to talk about the urinary system, and I'm using a figure to refer to from Merriam and their visual. I like this one because it's labeled. I also like it because they've made a frontal section of the kidney on the left side of the body, and also because they show the location of the renal gland sitting on top of the kidney in a fat pad. All of this is related to the urinary system. It is regulated by hormones, and there's where some of the hormones come from. They're regulated. Some come from the hypothalamus in the brain. But right now we're going to talk about the gross anatomy. The kidney contains about 1.5 million nephrons each, and that's the chemistry set. The microanatomy we'll talk about later. The blood is under very high pressure, as this renal artery is the first artery coming off of the aorta, which descends directly from the heart. So there's not a lot of distance between the heart and the kidney. The high pressure assists in removing plasma from the blood. In the Bowman's capsule, and as this plasma we call filtrate. At that moment in time it is still plasma, but we call it filtrate because it's now moved into the kidney. But as it moves through the nephrons, the 1.5 million of them in each kidney that you have, it becomes urine. Urine is made by removing salts and other toxins, by recovering other salts, and by recovering glucose and amino acids that might leak out with the filtrate. Remember, plasma is full of good things. It also has some bad things in it, and we want to wash the bad things out of your body, the toxins, the wastes that we can't reuse, and we want to recover those things that we can reuse. That's conservation, recycling, okay? When the urine is completely formed, sometimes it's concentrated urine, as you know, sometimes it's less concentrated. It moves down through the collecting tubes into the ureter and goes to the bladder. And once in the bladder, it eventually will fill up the bladder enough to where you will have the urge to urinate. When about 600 mils are there, you will have the urge to urinate. But you can suppress that as an adult. As a baby you can't, and as a very old elderly person you can't. You lose continence. You develop continence as you grow as a baby so that you can control your urination. And then, but you can suppress that. You can say, no, I'm driving, I can't stop right now. And then another 600 mils accumulates, and you say, I can still wait. About the third time, you stop and get out. But here's another problem. The amount of water you drink, and the way you eat, and other things that you put in your body can affect what happens in that bladder. Bladder is a storage organ, but also it is storing toxic wastes that are dissolved in urine. As those toxic wastes sit in that bladder for a long period of time, if you're not drinking water and if you're becoming dehydrated, those toxic wastes can precipitate out and lie against the bottom lining of your bladder. And you know what happens? A very common disease about both men and women, bladder cancer. That's right, bladder cancer is a very common disease caused by smoking. In fact, my father had it. He didn't die from it, but he suffered with it for many, many years, went through many, many treatments at a huge expense to the insurance company. It was close to $2,000 per treatment for chemicals to be pumped through his urethra into his bladder to try to suppress the growth of those bladder cells. He would have been better off to have his bladder removed totally, because ultimately the bladder cancer that was not able to be totally controlled snuck up into getting in his kidney, and that would have killed him eventually had he not died from other causes. I also had a friend who was 30 years old, back from Vietnam, who became a postman, who smoked cigarettes pretty heavily, who would go all day long without drinking, while he did his postal route, and at 30 years of age he ended up with bladder cancer. They cleared him up, and he is now 65 years old. He has not had another bout of bladder cancer. He is a survivor, a very lucky person. But he learned the hard way, and through a bunch of suffering with his treatments, that bladder cancer is a smoking issue as well as lung cancer. So, very important. Another infection that gets in the urethra, yeast infection in women quite a bit. But men can get infections too, and bacterial and yeast infections. Yeast is not a bacteria, it's a fungus. Are usually kept out by our first line of defense, and in this case, the first line of defense is urine, that is acid, that washes the invaders out that try to sneak in and come up through the urethra. A way to enhance the ability of that first line of defense to work is by using cranberry powder or cranberry juice, because cranberries have a chemical in them, or an enzyme in them, that keep microorganisms from being able to attach to the wall of the urethra. And that's why it's protective, and it's really true. You can look it up. There's plenty on it on the internet under medical sites like Mayo Clinic and so forth. So the message here is, drink water like you're supposed to, 8 glasses a day, and keep washing the toxins out. It's good for you to help all of your circulatory system to clean itself and wash the toxins out of your body. So there's a good reason for drinking lots of water. Not pop, not beer, not other sources like fruit juice full of sugary stuff. Water. Drink water. And you'll be healthier for it.